And here we come to the controlled substances portion of the video. So I take 2 controlled substances, and the first one I take is Ativan, or you might also know it as lorazepam. And Ativan is a benzodiazepine. It's an anti-anxiety medication that I take as needed to deal with severe anxiety. It's extremely helpful. I get 10 pills a month, and that's honestly the perfect amount. And the other controlled substance I take on a regular basis is Ambien, or you might also know it as Zolpidem. The type of drug that Ambien is called a sedative hypnotic. And I'm happy to say that, yeah, it actually does do the sedative thing pretty well. And you might be wondering, okay, Kit, Ambien is not a psychiatric medication, why is it in the list, etc. And it's because I take it to deal with the side effect of another drug, and that drug is lamotrigine. So in the early days when I first started taking lamotrigine, I started having these issues where I would be falling asleep in my classes. I was still in high school at the time, and I was actually voted most likely to fall asleep in class as my senior superlative, and I'm still not sure how I feel about that. But I went back to my doctor and I said, hey, I'm falling asleep a lot, I'm having issues staying awake and whatnot. And as it turns out, lamotrigine actually keeps you from having deep sleep in some people, and I was one of those people. And so my doctor prescribed me Ambien in order to give me that deep sleep, and I've been on it almost as long as I've been on lamotrigine, so I think I said 9 years, so coming up on 10 actually, which is wild to me. But yeah, Ambien's a great drug. On to the next one. And I have a few other drugs that are more on an as-needed basis, and the first one of those is clonidine. So clonidine is actually an antihypertensive medication, meaning it lowers your blood pressure when you take it, but it also has psychiatric uses as well. It's really cool because it actually works to get me out of a rut when I have the urges to harm myself. And I don't know how clonidine gets rid of those urges, I just know that it does, and I'm eternally grateful for that. And the best thing is that I haven't had to take it in a while, so I still have it just in case I need it, but it's been months now, which is really exciting. And in even more rare cases, I have it to also treat agitation when I'm in manic episodes, because I get irritable and irrationally angry at inanimate objects that haven't done anything to me. And I've noticed that when I take clonidine for that, it also kind of calms down that aggression, which I'm also grateful for. And I know I keep saying I'm grateful for this, I'm grateful for that, but like, I'm just really happy in general that I have medications that work for me, so you'll have to forgive my excessive gratitude. The next one is benztropine, or it's also called Cogentin. It's an anticholinergic medication, meaning it actually blocks acetylcholine, which is a neurotransmitter, and it's used to treat Parkinson's. Now, I don't have Parkinson's, but I do have medication-induced Parkinsonism. So I have some symptoms that are very similar to that of a Parkinson's patient, and it's because Zyprexa, that amazing antipsychotic I talked about earlier, messes with dopamine in my brain. And dopamine is a key neurotransmitter involved in movement. So you can understand how messing with the dopamine can cause unwanted movements. And so the biggest thing I deal with is I have a resting hand tremor like this. So when I don't take my Cogentin, my hands shake. And given my job requires me to be very precise and accurate, I have to take it at work so I can do my job, but the benefits to taking Zyprexa far outweigh having to take an anticholinergic medication a couple times a day. Like, it's a solution, it's fine, and I don't have any weird side effects from the benztropine, it just stops the tremors. So I'm super, super glad that works. The kind I have lasts 6 hours, so I take it in the morning, and then I take it at night when I'm about to go to sleep, so I don't get like restless legs or anything. And so this next thing are actually supplements I take, and I don't take a ton of supplements. I'm not really big into supplements, actually. I avoided them for the longest time, but my doctor convinced me to go on 2, and I will tell you about those now. And so the first supplement I'm going to talk about is fish oil. And it's not any type of fish oil I take. It has to have a certain ratio of EHA to DHA. And when that ratio is met, it actually helps with mood and depression and some other stuff. So I take 2 massive fish oil pills every day, and I hope they're working. But it's not like I'm going to go off of them. My doctor has me taking them, and whatever he tells me to take, I take. And the other one, and you can pry this also out of my cold dead hands, it'll be right next to the Zyprexa, is N-acetylcysteine. And I originally started taking NAC to protect my kidneys from long-term damage that can be caused by lithium. However, after doing some Googling and a little bit of research, I found that N-acetylcysteine can also be used to treat treatment-resistant obsessive-compulsive disorder. And I'm not really going to talk about it a lot on this channel, but I do suffer from really bad obsessive-compulsive disorder. And when I went on NAC, those symptoms went drastically down. Like, OCD was a really big part of my life, and it was really messing with me. It was really messing with my head, and going on that actually snapped me out of it and helped me return to a normal state. So I take 2,000 milligrams of that, which is pretty high, but it works really well for me, and yeah, pry it out of my cold dead hands. And it's so weird to think that a supplement that I can buy off Walmart.com helps me as much as it does, but I'm not questioning it. Now, if you're watching this video and you're thinking, wow, Kit, that's a lot of medications. Well, it kind of is, because I actually have symptoms of schizophrenia, which requires schizophrenia medication, and I also have symptoms of a mood disorder, which requires mood disorder medication. 2 conditions, 2 sets of meds, it adds up pretty quickly. And trust me, I'm not overjoyed to take over 10 pills every night, but I do it because it helps me. So if you want to share, what do you guys take on a regular basis? There's the comment section down below, of course, but if you want to keep the conversation going on other platforms, I am on Instagram and Twitter at SchizoKitzo. I love talking to you guys about mental health. And that is all for this video. I will see you in the next one. Bye-bye.
Vaughn for Sam's Sports Report. This is Sam Vaughn for Sam's Sports Report. Today's date is February 16th, 2022. This is Sam Vaughn. Today we're going to go through mental health, and we're going to just start with schizoaffective. We're going to start with what is a rapid cycle. Anyone with bipolar can experience a rapid cycle, but it affects women more than men. According to the Mood Disorder Association of Ontario, around 10 to 20% of people with bipolar disorder experience cycles. Between 70 and 90% of women experience cycles. It can happen at any time during a person's any experience bipolar. It can come and go. Not everyone has rapid cycles, which experiences change 4 times a year. A study published in the journal Psychiatric also suggests that rapid cycle might be more like to affect those who have bipolar symptoms for longer periods of time, were relatively bipolar first appeared, are more prone to risk, have a higher risk of suicide. 2 weeks per month. Other people may disagree. This does not mean factors of rapid cycling, only that they are more likely to occur. This disorder. How do bipolar and schizoaffective are the difference? Physicians have difficulty time diagnosing. It's common to make mistakes. Struggling with bipolar disorder and mania, someone with schizoaffective disorder will experience psychosis, delusions, and hallucinations. Do overlap achieving proper diagnosis through examinations. An individual with both schizoaffective disorder and bipolar disorder, which can complete the diagnosis that overlapping the symptoms. Psychotic episodes, in some cases bipolar disorder, hallucinations, and arise. 7 episodes of depression or mania. Disorganized thinking. This is a common schizoaffective, but someone struggling with bipolar will have disorganized thinking as well. And episodes of mania. Symptoms of depression during an extended period of time. Depressions or someone with either condition may demonstrate a loss of activities they once enjoyed. For someone who can experience pleasure, will have trouble connecting and making decisions. There are reports that highlights that alcohol and drugs among those will either condition when someone has significant symptoms overlap, or they will receive a diagnosis of schizoaffective disorder. I have picked 2 medications that worked really well for me. I think I'll start off with the ones that haven't been successful. Fanapt, no side effects, wasn't on very long. Paxil, suicidal.
Solian
C, hard for me to swallow. Invega worked out these meds. Invega worked the best out of these meds, except for Seroquel. I think it was felt like an average with still mental health problems, still had psychotic issues, and would stay up for 24 hours with no sleep. If I curled my hands and caused a lot of problems. There's other drugs I have taken, I'm sure. I just don't really know if they're relevant or if I want to go through them all. The reason Caplyta helps is Caplyta controls the cycles when I have them every 2 weeks. I guess that's kind of obvious, but it makes me feel better if I don't have the cycles. Seroquel makes me tired and helps me go to sleep, and since I have terrible insomnia, it makes me sleep. Those are my theories and opinions. This is Sam Vaughn for Sam's Mental Health Day.